Hello, my friends. My name is Yujung, and I am going to answer the question what actually happens inside an art therapy session in this video today. And I'm also going to answer some specific and common questions that I've been getting about art therapy and art therapy sessions. So if you're curious, please keep on watching. All right, so before we begin, I just want to mention quickly that each art therapy session is unique and it should be customized to the client and their needs, their situation, their therapeutic goals, things like that, and also their history. So everything I share today is not applicable for all sessions. Of course, it's really not a cookie cutter thing. So just keep that in mind. And the art therapist always customizes each session for the client. So let's get started with the topic of this video, what actually happens in an art therapy session. Although it is very hard to say art therapy sessions are like this or what you'll get in the session is ABC, I can still kind of give you a little bit of general idea or some of the common things or common structures that are used in an art therapy session, so you have an idea of what can go on in a session. So usually or most commonly, art therapy sessions have 4 different sections or 4 chunks that make up a structure of a session. So I want to go over the 4 things that you could commonly expect. So the first thing is the check-in structure. So check-ins are the beginning of, usually it takes place in the beginning of a session, and that's where the client and our therapist kind of talk together to get up to date on what the client has been doing, has been feeling lately, anything that has happened, or anything that the client wants to share in terms of where they're at right now. And also, this is the time to maybe go over some therapeutic goals, what the client needs to kind of address during the session. So it's just like a short period of time where we check in and we decide on what we could do inside the session itself too. So the second part of a common art therapy session in terms of structure is the art making part. So the art making part of a session can actually happen in so many different ways. It could look so different depending on who's doing the session, who's the art therapist, where it's taking place, and the materials available, what's the therapeutic goal, and so many more factors are taken into account, and that's what shapes the art making part of it. But in general, there are 2 types of making art that can take place in an art therapy session. The first type is an unstructured art making. So this is where the client actually leads the process in making art. So the client decides what they want to do, what materials they want to choose, and so they are more self-motivated and kind of directed in the art making part. And it's a little bit more open and unstructured. That's why it's called unstructured. But the other type of art making is actually structured art making. And in the structured art making, the art therapist gives a little bit more structure to the art making process for the client. So the art therapist may give something called a directive. And directive is kind of like a prompt or exercise or activity, but we don't use those words activity or prompts in art therapy work because they're not really accurate, kind of. The word directive is a little bit more accurate in a way because the kind of guidance that we give to the client are more like to give the client some direction into what they could do. It's a little bit very similar to a prompt, right? A beginning point and some guidance along the way, but it's really up to the client how they want to go and flow during the art making process, because it's not an art class, right? Art therapy is more about exploring oneself, expressing one's feelings, whatever is there, and there's no right or wrong. So that's the structured art making. But when it comes to structured art making, the art therapist does not willy-nilly give out directives or prompts in the session. Of course, every directive and every prompt is really carefully and intentionally presented in a very certain way. And they're chosen based on the client's needs, the client's goals, where the client is at, and how they're feeling inside the session itself, the client's history, their experience in making art, things like that, and the available materials. So those are all considered when the art therapist presents the directive. And so each session, that's why each session can be so different, because each person and each client is very, very different. During the art making process, the art therapist may be helping you out, or they may be just holding the space, so the client is the only one making the art. It really depends on the goal of the session. And during the creative process, there can be a lot of talking, or there can be no talking at all. It also depends on the situation and what is the most therapeutic thing for the client inside the session. So sometimes the therapeutic thing is to really verbally talk during the art process. Sometimes it's not. It's more therapeutic to be more silent and just focus on the art process itself. So a lot of the things that happen during the art making time, it really depends on the situation. So the third part to the common things that might happen in art therapy session is the discussion / verbal processing part. So oftentimes verbal processing or talking with the art therapist is a very, very important part inside a session. That is because a lot of things can come up during the art making process itself, or even during the talking part of the art. So it's really important to actually process whatever comes up during the art or after the art, because without it, it may be hard for some people to feel like they're in control, feel like they can manage things, or we just need to talk things out with the art therapist in order to gain more perspective, to explore what's going on in the art and what's going on with yourself. So that's the kind of goal for verbal processing and discussion part. It's to really understand where you're at, to use the artwork as a metaphor to explore different possibilities, find new solutions to problems, get different perspectives, or even gain more insight into yourself and into your situation in general. So the verbal processing can be very important. The discussion part and verbal processing can be structured / unstructured. Just like the art making part, the art therapist might be there to ask very specific questions for the client to answer, whether that is through the artwork or whether that is directly asking about the client's thoughts and feelings about a certain issue. So it can take, or it can be guided or facilitated in various ways, or it can be more led by the client, and the client can kind of start the conversation or take the conversation to wherever they want to go, and the art therapist is there to just kind of support them along the way as well. But the verbal discussion part can really vary in terms of topic. It could be talking about the artwork, it could be talking about how the client made the art, what feelings came up during that process, any thoughts that came up from the session and the art making part, or anything related to the client's goals and needs and maybe the problems that they're dealing with. So for example, they might be talking about trauma, they might be talking about addiction, they might be talking about anxiety or depression, anything that is really related to the client's mental health and needs and goals. They are discussed inside that verbal processing / discussion part. There are many things that can happen during this time. Our therapist can help the client kind of create a closure to the session itself and help the client transition from the art therapy session to back to daily life, back to everyday things, right? Back to whatever they were doing before the session or whatever they need to do next. So the client and art therapist can come up with some rituals, whether that is, asking certain questions about the session, reviewing the session, or even talking about what next, or what the client wants to kind of accomplish before the next session. Or it could also involve more like physical rituals, like doing some breathing together, or coming up with a body exercise or check-in. So there are many things that can happen depending on the art therapist and the client, of course, but I often find that our art therapy sessions do involve some sort of ending and closure activity. So for this part of our video, I wanted to answer some common questions that I get about art therapy sessions. So I'm going to pull up my questions here and then answer them. Let's see, the first question is, does the art therapist create art alongside the client? So this is a wonderful question. It really can be either way, right? The art therapist can be in the session making art together with the client, or maybe the art therapist may not be making art and it's just the client who's making art. What makes a difference? As I kind of hinted in the first part of this video, it really just depends on the therapeutic goals of the client. So if it's therapeutic for the client, for the art therapist to be making art together, then of course they can make art together. If it's not therapeutic and it's maybe more distracting that way, then the art therapist decides that it is not appropriate to make art with the client in the session. Second question is, can you use multiple mediums and techniques like finger painting, embroidery, puppets, woodworking, etc. Inside our art therapy session? So this is a really great question, but yes, the answer is 100% yes. There are so many mediums and art processes and techniques that can be explored within an art therapy session. As the questioner said, like finger painting, definitely, embroidery, puppets, woodworking, metalwork even. There's a lot of like junk art also. Really, I think of anything that can be made into art, into creating something, into expressing something. I think that can definitely be employed and incorporated within art therapy sessions. And the art therapist is there to really guide the client through that. And also they'll know if a certain medium or modality is suitable for the client, because not everything is suitable for everyone, right? Someone with a depression might not work well with a certain medium, but work really well with another medium, so it depends. And also art therapists are really well versed in a variety of mediums and modalities, and so most things are really in the scope of the art therapist. Third question is, do you talk during art therapy sessions? So I answered this question a little bit in the beginning of the video, but yes. If it is necessary, if it is therapeutic, helpful for the client, definitely yes. If it is not, if silence is more preferred by the client, or if silence is better for the therapeutic goal of the client, then it can be completely silent. The fourth question is, what questions do art therapists ask inside art therapy sessions? This is a great question. I think that art therapists ask a wide variety of questions, and all the questions are really there to help the client explore how they're feeling, explore the artwork, explore what's going on, understand the situation, and also find coping skills, manage, how they're feeling, manage symptoms, things like that. So it's really any questions can be incorporated within an art therapy session as long as it's really helpful for the client. Maybe example questions that I can share here are like questions that are posed to help identify emotions. So what are you feeling right now, or what are you thinking right now? That can be an example question. Or what do you think about this situation? Or maybe it's more about using the artwork to understand the situation better. So the art therapist might ask questions around the artwork, like what kind of feeling do you get from the artwork? What part kind of draws you in, or what part pops out to you? What part is significant for you? Things like that. So the next question is, can art therapists diagnose? So I think this is referring to, can art therapists diagnose mental illnesses? So this is a yes and no answer, and that is because it just depends on the situation, depends on where you're based in, so where you're getting art therapy, because in certain states there are art therapist license, or the art therapist have to be also a counselor or a licensed marriage and family therapist. So in those states, that means that art therapists are likely able to formally diagnose a person with a mental disorder based on the DSM, like Diagnostic Statistics Manual, in the US. So in that case, yes, art therapists can diagnose, but in other states where art therapists are not recognized as mental health treatment providers or psychotherapists, then no, art therapists will likely not be able to formally diagnose, because that is the scope of work that's only available for recognized psychotherapists in that state. So keep in mind that it just depends on where you are at. Another awesome question is, what happens to a client's artwork after session? Do they keep it, or it just depends? So another great question, it actually depends. So most often at a facility or a certain designated, art therapy studio, there are designated or confidential spaces where artworks can be kept. So in that case, a lot of the times clients do decide to leave their artwork or store their artwork in that facility's designated space, and they are able to take their artwork whenever they want to. And after a certain period of time, the facility probably has certain rules as to how much time has to lapse before an artwork can be discarded safely. So before that time period is over, the artwork has to be kept at that facility for that time. So that's usually the case for a lot of the art therapy facilities out there, or facilities that have art therapy sessions available. But it is really up to the client, though. At the end of the day, the client is the owner of their own artwork. They are the creator, they are the artist, so they can decide whatever they want to do with the artwork in general. But usually the art therapist can take the artwork, store it for the client for a certain period. And in cases where it's more like a community or a group project that happens in a public space, which can definitely happen, in that case, then everybody is consenting, the clients are consenting to the fact that the art is, in a public space. So that's where it will be held, right? In that case, they can't take the wall art with them. They can't take the mural with them. So it depends on the situation, but most often the client is really just makes the decision whether what they can do. Take the artwork with them or leave the artwork at the space to be kept confidentially. And another great question is, does it happen sometimes that a client starts crying and it's impossible for them to continue making art? What does an art therapist do in that case? So this is like a very specific example situation that could happen in an art therapy session, and my answer is that it can definitely happen. And in that case, it's really dependent on the situation, but the art therapist can just simply hold the space for the client, simply witness whatever comes up, or the art therapist can ask questions or maybe talk with the client to process what's going on, what's coming up. Or, the art therapist can introduce some art making or allow the client to kind of put those feelings into an artwork maybe. But it really depends on where the client is at. Are they able to do that? Are they willing to do that? Is it beneficial to do that? Those are all the questions that the art therapist has to kind of figure out in order to respond appropriately in that situation. So it kind of depends on the client and the situation. Last question I will answer about art therapy sessions is that how long does it take for art therapy to work? So this is not specifically what's happening inside the session, but maybe like how many times does it take for someone to get benefit from art therapy? It just totally depends on the goals and needs of the client. What I can say for sure is that even with one art therapy session, you can definitely feel the benefit or get the benefit from that. But if it is more like a short-term goal that you have, or more like you want to relieve some stress, then definitely one art therapy session can be amazing. But if you have more long-term goals, or if you have something that's been long-standing in your life that you have been wanting to kind of work through and process and release, such as trauma or something like that, then definitely having multiple sessions or more ongoing sessions is more helpful. So I've seen everyone from having one session to having years and years of art therapy, and that is only because they want that ongoing support, right? In certain situations like psychiatric hospitals where they have inpatient units and where it's the goal to just help stabilize the client first of all, then art therapy sessions are likely just given once to the client, and then they achieve their goal of stabilizing, and along with other treatments that they receive, and then they are discharged from that unit. So it just depends on the situation, and it can be just one session, and also it could be several sessions or years of sessions. Depends on the goal and the need of the client. So I hope that this was really, really helpful in kind of understanding what you expect from art therapy sessions and what could happen in those sessions. Of course, always keep in mind that each session is designed and customized uniquely for that specific client, so it's really hard to generalize. But I hope that this was useful, and if you are wanting to kind of experience therapeutic art making yourself online with other people together in a supportive community, I really would love to invite you to my therapeutic art making group that's going to be online. We're going to do weekly sessions together, and it's going to be so much fun and so much opportunity to relieve stress and express ourselves. So if you're interested in that, click the link in the description box below. You'll get more information. But thank you so much for watching this video. I hope you liked it. If you liked it, please do like this video, share it, and subscribe to my channel, Thirsty for Art. I will see you next time. Bye bye.